Hello, I'm Matthew Balti with the Acoustic Neuroma Association, and I'd like to welcome everyone to the 2024 ANAwareness Week presentation of navigating role changes and relationships after an AN diagnosis with Dr. Megan Sherod with the University of Central Florida. You can stay up to date with ANAwareness Week and everything the ANA has to offer at anausa.org. We also hope you'll make plans to attend World Vestibular Schwannoma Awareness Day on June 22nd. You can find more information about that on our website and social media pages, Facebook, LinkedIn, Instagram, and Twitter. Our website is a great resource for so many topics that you may have an interest in. There is a search function so patients can find just what they're looking for. The ANA is here to help, so please access those opportunities. So Dr. Sherod, if you'd like to turn on your camera, share your screen, and introduce yourself, we can get started.
Thank you for that, Matthew. So I'm Dr. Megan Sherod. I am a clinical professor at the University of Central Florida, and I'm also a clinical neuropsychologist. I have been with the ANA for, I believe about 5 or 6 years now. I love this community, and I'm so grateful that you guys keep having me back. I'm going to go ahead and share my screen now. All right. One of the most frequently asked questions that I get about life after an ANVS diagnosis has to do with what do I do with my relationships? How do I navigate my conversations with loved ones? How do I manage my journey going forward in terms of my identity? So you have likely had multiple roles throughout your life that have made up part of your identity. You might be a parent, you were a child, you may be a partner, you may be a sibling, you are most certainly a friend, you may be an employee or a boss, you may be a coworker, you may be a student, a retiree, or even a grandparent. And your identity and these roles likely evolved at least a little bit before your ANVS diagnosis. And your identity and roles will continue to evolve after your diagnosis and treatment. And so while you have maintained many of these roles, the onset of your symptoms, the treatment, or if you were in the stages of waiting, your role might now, your identity might now be one of patient, one of care recipient, one of advocate. Maybe you are a part-time employee or a part-time retiree. You may identify as somebody who is a person with an invisible illness, a person who is hearing impaired, a person with communication difficulties, or perhaps you are somebody that identifies as a person with a facial palsy. With these changes in your identity and these changes in your roles, you might feel a sense of grief, a sense of a loss of part of that identity. Particularly if you were somebody who was working full-time before and you've had to cut back on your hours, or maybe you have retired, or maybe you've had to change your job position. So you may be grieving the loss of one or more of these roles. You may be grieving the loss of a lifestyle. Sometimes our activities might change after we have been diagnosed with ANVS. You might be grieving the loss of your job or your profession, or you might be grieving the loss of friends or friendships that ended abruptly, or people who gradually receded from your life. You may be grieving the change in your relationship with your loved ones. You may be grieving the challenges that come with your new role as a care recipient, particularly if you were somebody who previously identified as a caregiver or as a parent. And you may be grieving a loss of intimacy with your partner. One of the things that I hope that you will all remember is that you are not responsible for other people's feelings about your ANVS. You are responsible for your own journey. You are not responsible for everybody else's journey. So some of the things, many of the questions that I get with regard to how to cope with this diagnosis, how to cope with cognitive changes, coping with these changes in your thinking abilities, changes in your emotions, in your behaviors due to the ANVS and everything that goes along with treatment and diagnosis. It's not for the faint of heart. You might have experienced changes in your auditory attention, and because you have a difficult time attending to things that you hear, it's going to affect your memory for things that you hear. And that can be really frustrating, especially if others have said to you before, well, I told you that already and you don't remember. Those of you who have attended some of my previous talks may remember I talked a lot about emotional dysregulation, particularly with anxiety and panic that is associated with both the location of the ANVS tumors themselves, as well as the cascade of neurotransmitters that are affected because of the tumor growth, but then also because of treatments, whether those treatments are surgical or whether those are treatments with radiation, or even the watching and waiting stages of that. And this is all very mentally depleting. It is both emotionally and mentally and physically exhausting from the time that you first notice these first symptoms throughout treatment and throughout different stages of your recovery. You may feel more sensitive to sounds and other sensations that can make living situations unpredictable and challenging to navigate. So having somebody come into your home if you're in a different room and having them say, I'm here, without any reference to where I'm here is, can be challenging. And so part of this talk is going to be how to initiate those conversations with loved ones. So how to say to your loved one, instead of saying, I'm here, say, I'm in the kitchen, or I'm in the upstairs bedroom, third to the left. Some people may feel like they are a burden to their loved ones. And many people with ANVS feel unseen because so many of the effects of ANVS and the treatment are invisible to others. So one of the things I would recommend is if you want to help your loved ones understand your reality, I recommend making a list. So making a list about how ANVS has impacted your life. So for example, one item on the list might be, it's hard for me to hear conversations and participate in them. Another item might be, the tinnitus is frustrating and physically, emotionally, and mentally fatiguing. Or it could be, I'm worried about participating in this activity that I once loved because I'm afraid I'm going to fall. Or it could be, my smile is different. And once you have created a list of as many things as you can think of, do your best to rank order them, with number one being the item that has most impacted your life. Number two, the next most impactful. Number three, and so on. And then share your list with your loved ones and help make what feels invisible to you visible. And that's really one of the most unique challenges of managing life with ANVS. It's that the cognitive, the emotional, even the physical symptoms are invisible to everybody else. And so for many people living with ANVS, it's this feeling of invisibility, of not being seen, of your lived experience not being validated, particularly by the people closest to you. And that's the part that seems to put the greatest strain on the relationships that we have with our loved ones. So I want to describe this figure that I call the circle of support for the person with ANVS. And so what I want us to all remember is that everyone that's involved in your journey is that we come into and remain in a relationship with ourselves as our only reference point. And so every one of us is going to vary in the tools that we have in our coping toolbox. And there will be some people that are just not capable of being who you need them to be for you. They may not have the tools that you need them to have in their coping toolbox. So I recommend that you find the people in your support network who are capable of being who you need them to be, and for you to hold on tight to those people. Those people that aren't capable may come back into your life later when either they're in a different place or you're in a different place. So when I talk about this circle of support, this might not necessarily be a lot of people. I when I'm asked questions about, well, how big should your support network be? I think it's important that we focus on the quality of the relationships and not quantity. And so if you have 2 to 3 people in your life that are there and see you and see your journey and are consistently running towards you with warmth and empathy and compassion, then you are doing really, really good, because a lot of people don't have 2 to 3 people that they can count on. So when we talk about these circles of support, those are the folks that I'm talking about. So you, as the person with AN, is going to be the center of your circle. And then the next circle outside of that is going to be your caregivers. And that could be a partner, that could be an adult child, that could be a good friend. The next circle outside of that is going to be other family who is not providing care, close friends who are not providing care. And then the largest circle is going to be other friends, your community. This might include your place of worship. This might include your neighbors. And so this is your circle of support. So who goes in these circles? Again, I want you to determine who is running towards you and who is not. So the people that are running towards you are people that will validate your symptoms. They will validate your diagnosis. They will validate your experience, even if it's not visible to them. This is very easy for me to say, and it's very difficult to do. But sometimes the journey forward means letting go of people who are not capable of supporting you and your experience. And sometimes letting go may mean walking away from those people. But other times, letting go may mean letting go of who you hoped that person would be for you. Chasing after someone who is running away from you because they're not capable of being who you need. Or somebody who's just not running towards you is only going to deplete your coping resources, and that will diminish your ability to heal. So when it comes to this circle of support, there are definite rules, and these rules are they're non-negotiable. So the first is that your circle of support, this is unidirectional. So support is only directed towards those people in smaller circles than one's own. So for example, you as the person with AN, you are in that center circle and you are there by yourself. You get to complain, you get to grieve, you get to lean on anyone that is in a circle that is larger than yours, which for your support network means everyone. Your caregivers, which might be your partner, it might be an adult child, it might be a good friend, they can grieve, they can complain, they can discuss with anybody in a circle that is larger than them, but they cannot complain, they cannot grieve to you. Family and close friends, same thing. They can grieve, they can discuss to anybody that is in a larger circle than them, but they cannot complain to the caregiver, they cannot complain to you, they cannot discuss how your ANVS journey affects them. And the same thing goes with friends and community. So everybody needs to stay in their circle, okay? Nobody gets to jump circle without your consent, without the person with ANVS's consent. Everybody else needs to stay in their circle. And this is where I hope that you will adopt the mantra of maintain your circle, stay in your circle. And it is really going to be up to you to reinforce, to maintain those boundaries. So no one complaining to someone in a smaller circle than they are in. Complaints are directed only to those in larger circles than your own. Another question that I often get is, okay, well, what can I do about this? What can I do to cope? How can I gain additional coping tools from my toolbox? One of those you've already started down that journey, and that's the support groups. This place is full of amazing group of people, this community, this ANA community. There are so many things going on every single week. There are so many support groups. There are so many different seminars that you can go to. There's ANAwareness Week going on right now. And so everywhere you look, there is support. So I would encourage you to use everything, every resource that this beautiful community has for you. If you find yourself needing something in addition to that, then I would recommend individual counseling or therapy, particularly with a counselor or a psychologist like me that specializes in chronic health conditions, grief, and loss. If you have somebody in your community that you know of that focuses on this, I would highly encourage you to utilize that resource. If you are not aware of somebody in your community that provides this type of support, or if you're not sure, then please feel free to reach out to me. I will leave my email address at the very end of this talk, and let me know where you're looking for a counselor, for a psychologist, and I would be happy to assist you in helping connect you with somebody that might be a good fit for you. The third thing that I recommend is respite care, and this is to assist caregivers, but also to increase the dignity and independence for people with AN and VS. So some of the things that come along with coping with the change in your identity and your role is figuring out what you've learned about yourself while you are on your AN VS journey. Have you learned to be more patient with yourself? Have you learned to be more patient with others? Are you practicing self-compassion? What have you learned about compassion for others, or what has this journey taught you about compassion for others? What about grace? Are you giving yourself grace? Are you giving others grace? How about your strength? You have been through so much on this journey that I hope that you have paid attention to how strong you are. What about pain tolerance? What have you learned about that? And finally, pacing yourself. This is an emotionally, mentally, physically fatiguing journey. I want to make sure that you are pacing yourself. You're not fatiguing yourself too quickly or trying to get back to your preferred activities too quickly. If this is something that speaks to you, I hope that you will take a moment to sit down and fill this out, just like the other lists that I recommended in terms of trying to communicate what your journey is like to others. One of the best ways that we can cope with changes in our identity and role is to make a list of needs versus wants. So in the first column, and you can do this in either order, I would encourage you to write down, what do you absolutely need to be happy? These are your non-negotiables. These are the things that you must have in your life in order for you to, at the end of the day, feel like this was a good day. I feel happy. I feel fulfilled. And on the other side, I want you to list what you want. Wants are aspirational goals. These are things that we would like to have in our life, or things that we would like to return, or especially after this grieving process, this sense of loss, things that we are going to strive for. But these are not the things that we absolutely have to have in order to be happy. And I would encourage you to make a list for yourself. And if you feel comfortable, share this with your loved ones. Share this with, if you have a counselor, share this with your support group. But I would encourage you to share this list only with those people in your life who have earned the right to hear it, because not everybody in our life deserves our story. We should not share our story with people that we don't feel like will see us, will hear us, will appreciate the journey that we've been on. I must admit, I am not a very good cook, but I do enjoy from time to time, I do enjoy watching different cooking shows. And one of these is the show Chopped. And I have to say, I don't remember where I heard this analogy, but I liked this analogy and thought it was very appropriate for our group today. So the Chopped analogy is really about life. That life has given all of us various ingredients in the forms of experiences. We can't change the ingredients that life has given us, but we can decide what kind of chef we'll be. And so what I mean by this is, if you've ever watched the show Chopped, you'll see that each participant has been given usually 3 to 4 ingredients that really don't go together. So they might give you watermelon and garlic. And, somebody else might get, salmon and sea salt and rosemary. And so the idea behind this chopped analogy is that life will give other people different ingredients than you. And some of those ingredients you are going to look at and you will envy because you think, gosh, I could have done a lot with that ingredient. But then to your other side, there might be somebody that life has given different ingredients to, like sardines. And what you create with what life has given you, with what ingredients you have been given, is really up to you. So my challenge to you, my question to you is, what kind of chef will you be? Moving on to active things that you can do. I would hope that you would consider respite care. And by the way, if you don't need respite care, that's great, but maybe you are in a place in your journey and in your life where you can volunteer to give respite care to others. So if you have the financial means, please consider respite care services. And this is just as much for you as it is for your partner or your caregiver on this AN journey with you. So things that what does respite care mean? Respite care can mean a lot of different things. So we're going to start with sort of the diamond, which is granny nannies. Granny nannies will provide stress relief for the household. They will do weekend and overnight care, meal preparation, bathing assistance, emotional support, light housekeeping, and even recreational activities. And this is to both support the person with ANVS, but also their caregiver, letting their caregiver get a little bit of a break, letting them to attend to their own self-care, but also affording the person with ANVN, particularly when it comes to bathing and other more physically intimate types of things where a person might need assistance. Particularly immediately following surgery, immediately following treatments. And so this could be, granny nannies, I think, could be a good, a good resource, again, for those that have the financial means to seek this. Another one is visiting angels. They will come, they will assist with laundry, they will do light housekeeping, they will do meal preparation, they can provide medication reminders, and they can also provide assistance with daily activities, daily living activities like dressing, grooming, and bathing. And again, this is just additional support for you as the AN person, person living with AN, to maybe take on some of those things that you are not feeling physically up to doing. So again, having somebody come in to do light housework, it's in order so that you are less physically fatigued, might be a good alternative if you have the financial means. Both visiting angels and granny nannies are nationwide in the United States. I don't know about services outside of the United States, but I would be happy to look into those if somebody wants to reach out to me and request that. How to locate a respite service. There are several different organizations that will help you with this. So Arch National Respite Network is one that can help provide, can at least link you up with somebody in your area in terms of matching people with services that they can afford. There are a lot of programs out there that will help pay for respite. So I would encourage you to look into different avenues in your community, different scholarships that are available. It may be low cost or free in your state. Different states vary by what resources they have available for respite care. If you are a veteran, then aid and attendance benefits may be available to you and your caregiver. So I would encourage you to look at the VA resources for that. And then there's also community supports that I would encourage everybody to look into to see if this is available in your community. In-home care can be expensive. And so if you do not currently have the financial means to hire a respite care agency, then there are community resources that can provide assistance to you. So many of those are through houses of worship. So these would be churches, temples, mosques. Some houses of worship have more formal respite sitter programs and what they call shut-in ministries that are supported by volunteers that can come and sit with you. They might not be able to provide any healthcare support or light housekeeping duties, but they are able to be an empathic companion and maybe somebody that can come and sit with you, particularly if you are concerned about falling and your loved one needs to run to the grocery, needs to run some errands, or needs to attend to their own healthcare needs. The person can come and sit with you just to make sure that there's somebody there to provide you companionship, as well as if there are any concerns about falling. And then hospice programs are available. You do not have to be in hospice treatment to qualify for respite care. Hospital-based hospice programs typically have more financial means and personnel, and they can provide respite care than standalone hospice programs. So again, you do not have to be on hospice treatment or on hospice care to qualify for respite care. So I encourage you to, especially if you live closer to like a metropolitan area, a lot of the teaching hospitals in the area will have these hospice-based programs and these respite programs. Additional community supports, civic groups like Veteran Supports, the VFW, Eagle Scouts, university-based student organizations may have programs to provide companionship for you and respite care for your loved one. There are a lot of different, especially these student-run organizations that will pair you with a college student who can provide companionship and can provide different supports, or they even might be able to provide transportation if you are not currently driving. And friends and neighbors. Sign Up Genius really is appropriately named. This is a great way to organize activities, to organize people who can help take you to appointments, who can help sit with you, or if you're just not feeling like cooking that day, somebody that can provide you with meal services. And this is something during treatment, immediately following treatment. And so using Sign Up Genius so that you can provide, it provides day and time availabilities to friends and neighbors. It's free for somebody to set this up. And this is a great way to organize friends and neighbors to sit with you and know who's bringing what casserole on what day, or who's going to take you to a follow-up appointment if you don't have a partner or an adult child or another loved one that is there to take you to every single appointment. And that is what I have for you today, but I always welcome questions. So, please take my email address down and reach out to me if you have any questions or if there are any other resources that I might be able to provide.
Great, Dr. Sherod, thank you so much for sharing. We do have some questions that came in ahead of time that we'll get to now. I really like this one to start. This person says, "It is hard for me to ask for help. Any suggestions on how to start?"
I think before we ask for help, we need to know what it is we need help with. So I would start by just making a list of everything that you think that you need. Whether that is, and it can be something as tangible as, I need somebody to drive me to this follow-up appointment. And it can evolve to something like, I need somebody to see me. I need somebody to hear me. I need somebody to listen to my journey. I need somebody to show me compassion. I need somebody to continue to invite me out to dinner. Even if I say no the first 10 times, please continue to invite me out to dinner.
Yeah, absolutely. This person says they haven't quite felt like themselves since their AN diagnosis. Their family has been very supportive, but sometimes I feel like they just don't quite understand what I'm going through. Are there any resources out there that you would recommend to help them understand the mental health challenges associated with the condition?
Absolutely. I would say there should be somewhere in the ANA library. I've done a talk for caregivers and tried to explain as best as I could from using stories that patients have told me over the years about their journey. But I would say there are several resources. So there's that talk. There is the handbook that I wrote a couple, 3, 4 years ago now. The cognitive, emotional, and behavioral changes that hopefully will outline for them. But I think the best thing to do is to start a conversation, because not everybody's AN journey is the same. And so it's great for somebody to listen to one of my talks or to read that booklet, but that might not be exactly what their loved ones, their person with ANVS might not be exactly what their journey is. And so I would recommend to the person who asked that question, it's a great question, is to make a list of what you need people to know. What is it that you need your family to see? What do you need them to hear from you? What do you need them to feel about what this journey is like? And again, making making a list about, I feel frustrated because it's hard for me to have a conversation, or when somebody's in the house and they say, oh, I'm up here, I don't know where that is. How can we be more specific about that, and how can I be part of the conversation? And I don't want to just sit at a family dinner and, because I can't hear the conversation, I can't participate. Is there, I would say, start that conversation, especially because they started, the person started off with, I have a great support network. I have all these people that love me and want to do things. And that's great. You can't ask for more than people who are running towards you.
And to piggyback what you said at the beginning, if people visit our website, anausa.org, there they'll be able to find the booklet, Understanding Emotional, Cognitive, and Behavioral Changes. And then they can also find your past talks, like you said, with caregivers and things like that as well. So how can someone talk to an employer about the changes in energy levels and ability to focus after having their AN treatment?
That's a great question, and one I get very often. I would say, part of my answer is going to be determined by what your relationship is like with your employer. So if you have an employer who has been supportive from the beginning, then you might be able to approach that in a different way. So again, I would encourage people to make a list of what they think that they need in terms of, you know, modified hours, or in terms of, um, you know, uh, maybe access to like a sick leave pool. If you have a larger, if you have a larger company, sometimes people can donate sick leave hours, just in case, you need to take a couple of hours off here and there to go to appointments, or if you're just not feeling well. If it's possible for a person to work out maybe a change in how many days they go into the office versus being able to work from home, if that's an option. I would hope that an employer who's known your journey along the way would be supportive. But we get into the realm of maybe employers who, for a lot of different reasons, are not able to be supportive, or are not able to modify your work duties. I would encourage you to, to speak with somebody, if you have HR, to speak about the ADA, Americans with Disabilities Act, because many of the accommodations that I write for, that I request rather, from employers for my patients, I provide a list with what I think, my clients will need in order to be successful in the workplace. And many of those suggestions are going to be covered under the ADA. The caveat here, though, is that it has to be a reasonable accommodation. So if, for example, if you are in a profession that requires you to be on a ladder for 6 hours a day, and being on a ladder because your sense of balance, that's not safe for you, that might not be something that's modifiable. So I think speaking with your employer first about how can you modify your job duties as assigned. If that's not possible just because of the nature of your job, then but you still want to continue to work with that particular entity, then I would encourage you to speak with your employer about changing your job duties, or even changing your job title, even if it's just temporarily. The idea is to keep you, if it's a job that you love, to keep you in that job in as close to your pre-diagnosis, pre-treatment job duties, to keep those as long as possible. But if that's not possible, then looking at ways to modify that. If for some reason it's not possible for you to stay in that industry, then I would recommend looking into vocational rehab, which is a service that is provided in every state, although some states have more advanced voc rehab programs than others. But with vocational rehab, you can, go through either retraining for a different type of skill and be in a different job. They will help work with you to help place you in a new position if that's what you want. Or, they can help you, provide you with funding to attend classes for maybe something that you never thought of you wanted to do before, but a new avenue and a new chapter in your occupational and educational journey.
That's a great perspective there. Thanks. Moving to a couple questions about fatigue and function. This person had their treatment Gamma Knife about 4 months ago. What can be done to help with mental fatigue?
Oh, that's a great question. So 4 months is not a long time. So we're looking at 16 weeks post treatment. And again, these treatments are not for the faint of heart. I mean, these are, every person who is watching and waiting through, every person who is 10 years post surgery, these are all warriors. I mean, this is, people oftentimes, right? We hear the joke, it's not brain surgery. Except for everybody here, it is, whether it's actual surgical resection or whether it's gamma knife or other types of radiation. So fatigue is going to happen. Okay. Our brain is the most complex organ that we have in our body. And because of that, it is going to take the longest to heal. And so we don't, if people can continue to heal from brain surgery 2 years, 4 years, 6 years after. And the same thing with radiation. It is going to take time for your brain for your brain to heal. So it's going to be mentally fatiguing. It's going to be emotionally fatiguing. It's going to be, it's going to be fatiguing, physically fatiguing. The other thing I think it's important to remember too is that, for many people, they don't know how long they've been living with this tumor. And so their body, their brain has had to adapt to this thing that has been growing for whoever knows how long. For some people, it might have taken years for this thing to grow. For some people, it might have taken, months. And so in that time, their body has had to adapt little by little. And so it's sort of going to be the same as, it kind of in reverse. Like if it took 8 months for this tumor to grow to the point where you were ready for surgery or you were ready to begin treatments, then you kind of have to give yourself at least 8 months for things to sort of try to go back to where they were before you had any symptoms of that tumor. And it might even be longer depending on how long the tumor has been there. With all of these treatments, whether it's gamma knife or whether it is surgery, although this is more so a surgery, you're also going to see this neurotransmitter cascade. So you're going to see these changes in dopamine, in serotonin, in norepinephrine, all of the things that sort of fuel that limbic system and that affect our emotional being. And so you might see times when you are feeling really sad and it feels like it comes out of the blue, or you might be feeling really anxious and it feels like it comes out of the blue. All of those things are related. And so, feeling sad or being anxious or being worried about whether or not you're going to fall, that is all mentally fatiguing too. It's emotionally fatiguing. It's physically fatiguing. So all of these things are intertwined. And so I wish I would be a billionaire if I could say, okay, do this. And this is a quick fix for this. But unfortunately, that doesn't exist because it is going to take time. And this is where I would say, give yourself grace. So in what can you do? If you find yourself, you're at a dinner party and you are feeling mentally, physically, emotionally exhausted, excuse yourself, go into a different quiet room, sit there for 15 minutes, do 15 minutes on, 15 minutes off, 15 minutes on, 15 minutes off. But what I would encourage you to do is listen to yourself. Listen to, all of your doctors, myself included, we can say all of these things, but you are the expert on you. We might be the expert on a very small little piece of what's going on with you, but you are the expert on you as a whole person. And so I would encourage you to listen to yourself. If you are starting to feel overwhelmed, it is okay. Show yourself grace and let yourself go and lie down. Or if you are feeling overwhelmed and hungry, then again, you need to give yourself some fuel. You need, there is nutrition that is designed to help the brain heal. And I'm not a nutritionist, but I would encourage people to eat things that will provide them with a little bit more protein that will, also assist their body in trying to heal from the treatments and the surgery. So there are lots of different things that you can do, from giving yourself grace, letting yourself rest, excusing yourself from other people, excusing yourself from a job, taking one of those breaks, which I hope that you have negotiated into your return to work contract. And again, just allowing yourself time to heal, because you will. It's never going to go as quickly as we want it to.
Mm-hmm. Those are some great reminders. This person says they saw a 2022 study that correlates ANs with cognitive impairment. Is there any possibility of restoring some cognitive function?
Um, so I would say yes, but when it comes to, so, we talk about anything that affects the brain. I explain this to all of my patients, whether it is somebody who's had a stroke or somebody who's had a brain injury or somebody who's had, any sort of brain tumor. If you think of your brain like a pie and you have something that comes in and affects that, so it's sort of like a person cutting that pie. Even if you don't take a slice out of that pie is no longer 100% whole. Again, it can't ever be whole again. So I think having the expectation of returning to your cognition, returning to where it was before you developed the tumor, that expectation is too high. But can many people get to 80, 90% of what they once had? For most people with ANVS, that is absolutely attainable. But you got to work at it. Just like physical therapy, in order to regain, the functioning in an injured limb, you have to do the same thing with your brain. And so again, it means not overtaxing your brain. It means, again, giving yourself grace, letting yourself rest. Sleep and rest is going to be your friend. And when I say rest, I don't mean you trade in the computer screen for the small screen on your phone. Resting means whatever makes you feel rejuvenated. For some people, that's going to be a nap. For other people, that might be, just sitting by the pool or sitting by the ocean or, just sitting outside. It's whatever it is that makes you feel like you can breathe again. So I would encourage people to start with that. And then there are little techniques that you can do to help regain some of what you feel like you've lost. In terms of auditory attention is going to be tricky because for many people, especially after they've had surgery or, even if they've had Gamma knife or as they're, in the watching waiting stages, you might lose the ability to hear in one ear. And so then it means prioritizing hearing in the other ear. So, you might not be able to rely on your auditory memory as much. And remember too, that if you can't hear it, you can't attend to it, you can't be expected to remember it. So perhaps we change the modality of things that need to be remembered. So, and I'm using attention and memory because those are the most often things that are affected by ANVS. So you have important information needs to be provided in writing. I would encourage you do not leave your doctor's office without a printout of the notes or printout of what it is that you need to do. Medications that you might need to take, follow-up appointments, anything that needs to be remembered, what you talked about in that appointment. And again, as much as you can, if this is somebody who is going back to school, getting notes from the professor or getting transcripts of lectures or getting, slides like we had today, having those in print so that you can review them as you need to. Having and either, again, if this is somebody who's taking a class, having a designated note taker that writes notes for you, or if you're somebody who still has a lot of preserved hearing in the unaffected ear, being able to record lectures or being able to record meetings for work and then replaying those again later on and listening to those just to reinforce what you have, to reinforce your memory. Processing speed is another thing that's typically affected, but that's also something that just gets a little bit slower as we age anyways. And I think it's important to remember that the wisest people I've ever met are people who took their time. They didn't rush from the start of a job, through the end of it. I mean, I think about all of the things of quality control that we need, where we would not want somebody to rush putting our car together, right? The mechanic putting our car together. We want to make sure that, things are done correctly. And a lot of that is going to just take step by step and take time. So again, with processing speed, part of that is just going to be natural aging. That might not have very little to do with the ANVS at all. But again, I think just allowing ourselves grace in a world that is minute by minute, and I need to have this right now and right then. I would say, stand your ground, and unless you are an emergency room surgeon and this appendix has to come out right now, I would encourage you that to take your time. Um, you know, don't be too hard on yourself. Show yourself grace. I tell my patients a lot, thou shalt not should on thyself. So, I should have done this, I should have done that, I should be able to do this more quickly. You know, this is your journey. And at the end of the day, the only person that you have to make happy is you.
We've got one more here. We know that this can be a life-altering diagnosis and treatment. So what can people do to manage the stress of the life changes they're experiencing and even that feeling of loneliness that might come with that?
That's a great question. I would say, first of all, I mean, they've already taken that step. If they're here and they're watching this, they've already taken that first step to reach out and connect with people and to get as much information as possible. I think, this, like many journeys that affect the brain, whether it's stroke, traumatic brain injury, brain tumor, in many ways, this is sort of a solo journey because no two tumors affect a person exactly the same way. A tumor might affect, this person's ability to do their job because they relied on their auditory attention, but it didn't impact this artist's ability to paint the most beautiful canvas. And so I think it's important to remember that everybody is going to be affected a little bit differently. And so being able to say, okay, this is my journey. I'm not alone. There are other people who know what this feels like, but they don't know what it feels like for me. So starting there, reaching out again to the ANA, to the support groups. If you're still feeling at the end of the day, you're still feeling disconnected from others, if you're still feeling sad, if you're grieving and you need additional support, then absolutely reach out to a counselor or to a psychologist. What I would recommend is that when reaching out to somebody, and again, this is where people are invited to contact me, where I can help them try and find people in their area where that I think might be a good fit for them. I really focus on providers, mental health care providers who have a background in either health psychology, neuropsychology, or who have specialized in grief and loss, chronic illness, because not every counselor focuses on the same thing. So I would not want, for example, I would not want to refer somebody to a counselor who's really focused more on working with people with attention deficit hyperactivity disorder, because that's a very different journey than ANVS. So I would say, again, find that support. There are online supports that are not ANA, but other types of chat rooms, and I think those can be kind of hit and miss. There might be, I think there are some places that are wonderful places that provide resources and that build each other up, and then there are other places where it's the idea of the misery loves miserable company. And I think you need to know what it is that is going to be most beneficial for you, and you're the only person that knows that. Again, I think a lot of times people look to myself and my colleagues on the board as the experts, and we are in our fields, but we're not the expert on you. And so what works for one person might not work for somebody else. And so I would encourage you to find a community or to find a therapist that really appreciates who you are, what your goals are for yourself, and what your goals are for your journey.
Well, Dr. Sherod, thank you so much for your time and presentation and all the great information on those changing and navigating of roles and relationships. We certainly appreciate, and I know all of our members and patients do as well. And thanks not just for this, but for also all the other resources that you've helped us create with the ANA. We certainly appreciate it.
Thank you.
Thanks, everyone. Have a great rest of the ANAwareness week.